Here we go. Hello, 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 everyone. Thank you so much for being with us this evening and for your patience. As you all are coming in, we'd love to hear where you are from. Welcome. Thank you all so much for being with us. Where are you from? What city, state are you coming from? Well, we are so thankful that you all have saw fit to join us for part 2 of this wonderful conversation. We will be beginning in 1 moment as others are still coming in the room. Welcome. We are so pleased and thankful that you all are with us this evening.
People aren't telling us where they're from.
We'd love to hear where you all are from. Feel free to put it in the chat box. Let's see. Hello, Amy. Hello, Anita. Hello, Bill. Hello, Shanetta. Thank you for being with us. Hello, Nancy, Sheila. Oh, hello, Ursula. Great to see you. Where are you from, Amy? We will be beginning in a few seconds here. Thank you all for your patience. Southeast Florida. We can't forget the wonderful Atlanta. Welcome. Thank you all for those who are coming in. We welcome you to a great evening and conversation. If you'd be so kind as to tell us where you're from. Hello, Nancy. Thank you. New Hampshire, welcome. The Diocese of Atlanta, welcome.
Yeah, there's Bill Monk.
Welcome, welcome. And for the sake of time, we're going to go ahead and get started. We appreciate you all for joining us this evening. And on behalf of the Absalom Jones Episcopal Center for Racial Healing, where the wonderful Dr. Catherine Meeks is our executive director, we welcome you to a conversation, a part 2, actually, town hall meeting on intergenerational mental health and racial healing. And we knew that after part 1, we had to do a part 2 because it was so incredible. You all had so much feedback and wonderful things to say and desired more opportunities to learn. And so my name is Dominique Hardy and I serve as the program manager for the Center for Racial Healing. And before we begin, if for any reason we encounter any technology issues or disconnections, we ask that you would kindly sign out and come back in through the same link that you originally entered in. And if for any reason the same thing happens to us, we thank you in advance for your grace extended. And so also at the appropriate time, we will ask you to place your questions in the Q&A box, which is different than the chat box here. And then we will get to them at the appropriate time. And so without further ado, I present to you all the Executive Director for the Center for Racial Healing, my shero, Dr. Catherine Meeks.
And I don't pay her to be my propagandist, but she keeps on doing it anyway. So thank you, Dominique, and thank you all for being with us this evening. This topic is so important, and we know that doing even 2 town hall meetings on it is quite inadequate, but we have to talk about the connection between physical and mental health as much as we can and live into it in a more intentional way as we try to work on healing our country and healing our community. And so I'm just deeply grateful for all of the wonderful people in our community that are helping us to do this work, and grateful for the Absalom Jones Center's existence so that we have a container from which this work can come. And I invite you to visit our website to learn more about what we do and to sign up for our newsletter, and so you can keep up with the programs that are being presented. It is my honor to present Dr. Gander, who will tell you a little bit about herself and who will be the moderator for our event this evening. And we have been working together now for a good little bit on putting together programs around wellness. And it's really important, I think, for all of us to understand that talking about race is one thing. Talking about wellness and healing means that you include race and you include everything else. And we tend to be, we take pieces of things and try to work on it instead of holistic approaches. I think that the lack of holistic approach has led us to be in the place that we find ourselves at this present moment. And so we at the Center for Racial Healing really are trying to be holistic in our approaches. So we talk about racial healing, environmental justice, immigration, prison reform, all of it is all a piece of the same cloth. And we have got to keep holding that up in front of everybody. So we are honored to have this panel tonight, and I want to let them get to it. So Jennifer, the floor is yours.
Good evening, everyone. Thank you, Catherine. Thank you, Dominique, for the introduction, for opening us up, and honestly, for bringing us all together for the second part. I am a clinical epidemiologist. I work at Kaiser Permanente here in Georgia. And I've been working with Dominique and Dr. Meeks this past year on developing these community outreach opportunities. Tonight, we have two incredible, brilliant leaders with us to talk more about the importance of health and mental health as we continue our discussions about the struggles we've all been experiencing during this challenging time. As we heard back in May, our esteemed speakers from the Part 1 Town Hall, mental health and physical health, they go hand in hand, they're intertwined, and one impacts another. The unpredictability and the uncertainty that this past year has given us, that we've all experienced with COVID, has just shown to have adverse mental effects on those people who were rather healthy before the pandemic, and then especially among those that had pre-existing mental health conditions. We're honored tonight to have Ms. Latrina Foster and Dr. Lynn Paxton with us tonight to talk more about mental health in our community and what we can do to help one another. I look forward to a lively discussion among the group and learning along with you how we can help ourselves, we can help our community, and we can look towards the future together. So without further ado, I want to open it up to Ms. Foster. I'm going to present their quick bios, and then I want to open the floor to Ms. Foster and then to Dr. Paxton. So Ms. Latrina Foster is the director of the Fulton County Government Department of Behavioral and Developmental Disabilities and a licensed professional counselor. She is motivated and goal-oriented leader and has been in the Department of Behavioral Health and Development since 2008. She's experienced at providing case management services, therapeutic interventions to individuals with disabilities, and emphasizes the importance of education through her leadership in various mentoring, training, and educational endeavors. Dr. Paxton joins us from the Fulton County Board of Health. She is the director of the Fulton County Board of Health. She honed her public health skills while working for the Centers of Disease Control and Preventive Services and is a retired public health service captain. Throughout her leadership roles with the CDC, Dr. Paxton continued to gain experience with infectious diseases and is acknowledged as an international leader for HIV prevention and was the Zika coordinator for the CDC's Center for Global Health. She actually came out of retirement in 2020 to join Fulton County Board of Health as their health director to lead the people of Fulton County through this very challenging and pivotal time. Again, I am honored to be joined by these two sheroes, and I open the floor first to Ms. Foster to give us a background of her experience, a breadth of experience, as well as within the past 18 months. And then Dr. Paxton, the floor is yours, and then we will open it up for a Q&A.
Thank you so much. It is my honor and privilege to be here today. Thank you for the invitation. Thank you for inviting me to this panel, because I think that it is a very important conversation, the intersection between mental health and physical health. It's imperative that we all recognize that there is an intersection between the two. And you cannot focus on your mental health without focusing on your physical health, and vice versa. I think Fulton County has done an outstanding job over the last 18 months ensuring that we gave people access to care, which is a huge barrier for a lot of individuals. We want to ensure that individuals that are indigent, do not have insurance, have the same access as someone that has Kaiser Permanente, no pun intended, Blue Cross or Blue Shield, but ensuring that people have the same level of care, access to care. I have been in the world of mental health now for 20 plus years. I did a lot of work around trauma and reactive attachment disorder, working with individuals that have been placed in therapeutic foster care and did not have that initial bonding with their birth parent at the time of birth. Did a lot of work with parents as well as families of keeping their children within the home. A lot of the children were at risk of being placed outside of their home, doing a lot of work around individuals being exposed to trauma on a day-to-day basis as a result of the neighborhood that they lived in. And so therefore, their mental health disorders were kind of manifested based on the environment where they were placed. Fulton County has focused a lot on re-entry programs, ensuring that people are not staying in jail because they have a mental health disorder. I'm very proud to say that now at the Fulton County Jail, we implement a correctional mental health screening at the time of booking. So anyone that's booked into the jail, we do a screening. And if you score 5 or more, that gives us a flag saying, hey, we need someone to dig a little bit deeper with this individual. Let's ensure that they're not in jail longer just because they have a mental health disorder. So our team is immediately triaged to ensure that this individual truly has a mental health disorder. What are some resources that they need? Because perhaps they're in jail because of a quality of life crime. And we don't want them to stay in jail 45 to 60 days for a quality of life crime, whereas someone else arrested for the same thing because they have access to income or money will be able to be out of jail within 24 hours. We do a lot of exciting work in Fulton County. I'm just excited that the conversation is now opened up around mental health. I think that as we transition through COVID, as we went through COVID, and people realized that the conversation was the same across the board. Everyone, the 2 key words you continued to hear was anxiety and depression, right? Whereas before we weren't hearing those words consistently from every single person that spoke. You can turn on any news station, you can click on Zoom, you can get on Instagram, you can get on Facebook, and you're going to hear about anxiety and depression. I'm excited about that. I'm not excited about the fact we had to go through COVID, but I'm excited about the fact that COVID opened up the conversation and normalized it for us because we were all experiencing the exact same thing, anxiety and depression. And so for me, that is a beginning point for us to continue where we are today. Let's keep talking about it. Let's keep empowering our people, empowering our community with education and knowledge around mental health, because knowledge is power. So if we're able to educate one individual, they turn around and educate 2 more. As time goes on, we have a community and a nation that's educated around mental health and prepared and positioned to help someone that is in need of assistance around mental health. And they won't feel the shame to stand up and raise their hand and say, guess what? I'm experiencing some depression or I'm experiencing some anxiety. Thank you. I look forward to this discussion today.
Thank you so much, Ms. Foster, for that introduction and for giving us a bigger, more detailed overview of everything that you've been doing and working towards. Dr. Paxton, the floor is yours now.
Well, as you've mentioned before, it was never my intention to have anything to do with a global pandemic. I had already retired. I was off doing what one does when one retires, traveling and volunteering and do the other things. And then, of course, the global pandemic hit and I came out of retirement and took over this job. And, so what, as I would mention to all of you on the panel before we started, I've been on the job since basically May 1st of last year. And during that time, our focus, because we were in the thick of the pandemic, our major focus was on just keeping people out of the hospital and from dying. Then once the vaccine came along, our focus is switched to getting people vaccinated. So again, with the same goal, keeping people out of the hospital and not dying. So it has been obvious to me that, as it has been to everyone who has been living through this pandemic, who reads the paper and all that, that as Latrina, as Ms. Foster has said, that we have not only a global infectious disease pandemic, we now have a pandemic of mental health illnesses. And one thing that I read about today is that on tomorrow, the CDC is going to be having a webinar at 10 o'clock in the morning, 10 to 11 in the morning, that's looking specifically at the effects of this on the public health workforce. Because we, of course, think a lot about the general public, the person who's lost their job and is now depressed, the person who has suffered some loss in their family due to COVID and is having anxiety or depression about that, or even people who've had no particular loss in their immediate family. The whole atmosphere that we have been living through this past year just lends itself to anxiety. It is like if I were to construct something that I wanted to do a mass experiment on how to induce anxiety, I think I would take a global health pandemic that kills people. I think that would be what I would choose. So in this, the CDC did an online survey of from March to April of this year of state, local, tribal, territorial public health workers, and they got an overwhelming response. And they found that with many of them reported symptoms of at least one mental health condition, in the preceding 2 weeks, including depression, anxiety, PTSD, and even suicidal ideation. And in some cases, they've actually, have compared that to surveys of the general population and have seen that the prevalence of these disorders is actually higher among public health workers. And I can say, no surprise to me, because you're dealing with a pandemic, trying to save people's lives, a pandemic in the midst of incredible politicization that did not need to take place, but did happen. So there's often hostility on the part of the public to public health providers. So I can say that from this sort of evidence, from anecdotal evidence of others that I work with and all that, I know this is very, very real, for us. As a person who's just living through a pandemic, I again have seen, we have not done surveys because we are not at the health department. We are not at that stage yet of having, I would have to say, the luxury of being able to do like surveys about mental health disorder. We are still just trying to get people vaccinated. However, I do live in this world. I am very well aware. I have an 18-year-old daughter who spent the last year in virtual learning. And I know, as from my other jobs I sit on the board of like the Decatur Education Foundation, and we know that there have been increasing rates of anxiety disorder, mental disorders manifesting among school children. And in fact, on my block, a 12-year-old girl committed suicide a few months ago. We do not know whether or not it was related to the pandemic, because how do you sort that out? But it's something that's very, very real. So we are very, at the health department, where, as I said, we're concentrating now on, dealing with the infectious nature of this pandemic, getting people vaccinated. I am happy to say that though, at least with the falling rates for now, hopefully before the variants take over and they go up again, we are getting a little bit of a breathing room in that we can, start returning a little bit more to what we have done in the past. And so one thing that factors into all of this too is the effect of racism in our society, and particularly in Fulton County, which is about 40% Black and about 10% Hispanic and other. We have a lot of people of color in Fulton County, and we know from long experience that the effect of systemic racism is, number one, real, and despite the fact that it is now being used as a cudgel by people who seek to deny it, who bring up or are using the critical race theory, have 90% of whom don't even know what it is, but they do know it sounds good if you're on as a soundbite to be, to be against it. But we do know at the health department that racism plays into all of these things. We also know that mental health and well-being also plays into general health. So it is our intention as we get into more of a normal state of affairs, i.e. not having a global pandemic, that we will be able to hopefully address all of these in, at least do what we can to address all of these in a more holistic manner. So those are my remarks.
Thank you so much for those remarks, Dr. Paxton. Dominique, I want to pause for a second and see if there are any questions that were either in the chat or within the Q&A. If not, I have a few discussion points of my own.
Yes, thank you, Dr. Gander. The first question was, if you could envision the correctional facility differently, would it be a mental health rehabilitation or something? In other words, what is the correctional facility doing right or wrong in regards to mental health?
Well, I would say within Fulton County, what they're doing right is that they have an excellent healthcare provider that has a complete unit around mental health. And so there are some individuals that are incarcerated that have real charges and that will probably spend some time in jail. But I appreciate the fact that while they are incarcerated, their mental health is not ignored within Fulton County Jail. I'm speaking for Fulton County Jail in itself. And then I think I'm proud of Fulton County Jail around the fact that they are willing to allow us as mental health professionals to come in and do a correctional mental health screening. I'm sure there is not one sheriff at the Fulton County Jail that thought that they would have to have some knowledge and experience around mental health when they signed up for the job. But they're team players. It's a multidisciplinary team where we come together, we discuss cases, and I just applaud their openness and willingness to hear us out as mental health professionals to say, hey, we can't allow people that have a mental health disorder that have been charged with a misdemeanor or pending misdemeanor charge remain incarcerated because they don't have access to the same resources as the next individual. If I had a magic wand and could wave it, it would be that they didn't even land in jail, that we had a very robust diversion program which we have a preliminary one and we're looking to expand it. But when an officer encounters someone and they feel like, hey, I think there may be some mental health needs going on here, we had a facility where they could take them, divert them to us, let us wrap them with services to ensure that that whatever has placed them where they are today, and it may be because it is untreated mental health or substance use disorders, that once they come here, we're like a no wrong door. And once you enter our door, we will wrap you with the necessary resources and services to ensure that you're able to obtain a sense of independence and have sustainability within your life, and also have treatment around your mental health or your substance use disorder.
Thank you very much. And then the last question that I've received so far is, in light of what you all are saying about the pandemic, sometimes it's easy to feel hopeless without knowing what the outcome goal is. What does mental health recovery even look like at this point?
Yeah, we've had a lot of conversations around this because when the pandemic first started, we had community conversations probably 4 times a week, and we're cheering people on. We're like, implement effective coping skills, try A, B, try C, D. And then as time went on and we found ourselves still in the midst of this pandemic, as Dr. Paxton said about the impact of the pandemic on mental health around public health workers, I mean, I found myself losing therapists because they couldn't do it anymore. They were just burnt out because the same advice they're giving to individuals within the community, as soon as they get off Zoom, they're trying to incorporate it in their own lives. And so every day they're hearing the same story that they're battling with themselves. And so I will say that hope is not dead. As Dr. Paxton just indicated, the vaccine is here. So that should give us some hope to know that if we get vaccinated, we can be around our families. We don't have to continue to isolate ourselves. We can kind of push back from Zoom a little bit, still implement, strategies to ensure that we maintain our safety, but we don't have to be in this bubble anymore. So hope is possible. I think that through mental health, we always try to encourage individuals during the pandemic and even now that recovery is still real. Get engaged. If you have to be in a group session and you have to do it on Zoom, just get on Zoom and do it. That way you can hear from other people and know that you're not alone. And we always share with individuals that it's okay to not be okay, but don't stay stuck there. Implement some type of strategy to kind of motivate yourself. Know what works for you. If it's journal writing, if it's exercising, if it's hosting a Zoom meeting with all your friends and family, just to have some laughter, create new happy memories, but do something. But we all know that we're in a place, we all have been in a place that we weren't okay, but don't stay stuck there.
Ms. Foster, I think those are excellent points. And I kind of want to build on that and ask and pose a question to both you and Dr. Paxton. So in the past year, over the past 18 months, there have been a lot of challenges, right? And I'm curious, given your all's wealth of experience within your field, are these new challenges? Like, is this, you mentioned, Ms. Foster, that, you're hearing the words anxiety and depression from everybody now. And I'm just curious, like, are these new challenges? Are these nuanced challenges? Like, how do these compare to like the time pre-COVID, or are they all just enhanced, right? Because of the past 12 months and what we're going through?
Well, in my experience, which is not as extensive as Ms. Foster's, but in my experiences, I think we can't deny that this pandemic has enhanced what's out there. The fact that there are just so many people reporting the same issue in relation to this pandemic obviously means something. But do I think that these were just all magically created by the pandemic? No, I think in no way whatsoever. We have known about for years. I mean, we're well aware that the high incidence of anxiety disorders and depression. It's a in and of itself, some people have called these to be said these are pandemics themselves of depression, eating disorders, and the like. Those didn't start with COVID-19, but COVID-19 has made many of them worse. That's my feeling about it.
And you are absolutely correct, Dr. Paxton. Mm-hmm. Everything that we're talking about today, nothing is new.
Mm-hmm.
So kind of thinking about that, I'm curious, and I'm picking out words from both of your all's introductions. We did talk about just how quickly things have moved, right? Like how quickly operations were set up to try and keep people alive, and then once the vaccines were here, to try and roll them out as fast as possible. And Ms. Foster, you also mentioned just how it seems like in the past 6 to 12 months, the conversation around mental health has really picked up. And I'm hoping maybe that means that it's getting less stigmatized and people feel more comfortable. So trying to think of like a positive spin on things and like put a positive spin on things. Like, are there things that you have seen in the past 12 months, given everything we've gone through, that are actually like innovative, positive, something we can carry forward with us, like once we finally get out of this like murkiness that we're all in?
Yeah, the first thing I would say is access to telehealth. So now we have individuals that live in rural communities that now have access to care, where they don't have to worry about trying to make a 2-hour commute to meet with a psychiatrist. So I think it's increased access to care because now the world is receptive to telehealth. I mean, when you have the Department of Community Health willing to allow agencies to utilize telehealth, whereas in the past, it was 0 to none, where you could utilize telehealth and be able to be reimbursed for the service that you rendered via telehealth. But now it just increases access to care. because I think telehealth will be ongoing.
And can I ask a question around that preoccupies me about people who don't have technology? You know, I mean, telehealth is wonderful, and I've done it with my primary care doctor. But if I lived in rural Georgia with no computer, then, you know, I know it's just another layer of challenges, but is there conversation at least around those challenges, and are we thinking about what can we do about it?
So once in a while, I just skip through funding opportunities to see where the federal government is as far as their thinking, and kind of helps me gauge what's next. And you see a lot of funding opportunities around technology, providing different counties and agencies resources to technology to ensure that constituents have access to computers. A lot of resources have been dumped into ensuring that there are hot spots in various areas and rural areas, not just in the metro Atlanta area or metro DeKalb or whatever. But so you see a lot of funding opportunities around technology. I will say that you've seen a lot of agencies step up, and they have been innovative, like the library systems being willing to loan individuals laptops with Wi-Fi cards so that they have access to the internet. Because they had to do the same thing with the school system, right? So if all the kids are at home and they're trying to learn from home and they don't have internet access because their parents never had internet, you saw a lot of resources being dumped into that, as well as I think it will continue in a hybrid model. So for those individuals that have access to technology, feel comfortable utilizing technology, they will be able to have those telehealth appointments. And then for those individuals that kind of want to be in front of someone, they don't want to be in a bubble anymore, they'll be able to have access to the face-to-face as well. But I will say, I think the federal government is dumping additional resources to ensure that people have access to virtual platforms and technology.
Well, you know, this is the time that we in public health and mental health and in all health services really need to sort of grab the money and really use it and work with it, because this is not usual. Usually, you know, public health, behavioral health bubbles along in the background, you know, sort of keeping along, and people don't think about us, and then they like start taking away from our budgets. And then, so basically now money is starting to flow our way. One thing that, you know, what we're having to start to think about, which actually vaccination made it crystal clear to us that we couldn't rely strictly on technology and like internet access. I'm talking specifically about making appointments. We found that particularly for older people, were the first people to be, after healthcare providers, to be targeted to get vaccinated, and we consistently found that older people of color couldn't they couldn't use the tools of going online and spending hours looking for something, or even once things opened up, even still, it's still a barrier for many people to use even the internet for, just for making, appointments. So what that made us realize is that we had to go to them, which we did in various ways related to vaccines. But what we're building on now is that as we go more back to, dealing with non-COVID things, we're going to be using our, our mobile units, for things to go out, specifically at the health department. We're thinking more about things that are, tangible, medically related, like, high blood pressure, HIV testing, things that, require sort of like, a one-time thing, or, relatively circumscribed thing to do. But honestly, we need to be thinking innovatively about how we can use the resources that we have for other things. Like, why couldn't we not with medical, with mental health? I just flashed to, that I think many of you, this shows my age, but maybe many of you have seen the Charlie Brown, cartoons with Lucy. who sets up her little, psychiatrist, who gives out psychiatric advice for 5 cents at a like a lemonade stand. And, but why can't you take outrageous ideas like that and use them? Like, you take advantage of the mobile units that we have and maybe, schedule a doc in a box, appointments to go around to various people and to do sorts of things.
Absolutely.
I'm a mental health professional, but, one thing that the COVID epidemic has taught all of us here is that we need to think about different ways of doing things. And I think that we should apply that as well to mental health services.
I couldn't agree more. I grew up in rural Arkansas, and we did not have libraries, but we had bookmobiles. And they came through our neighborhoods. You could go on, and it was a little moving library. So if we had these movable clinics, these mobile clinics that went in neighborhoods, and even with setting up appointments for people and all of those things, it's amazing, isn't it, that we are so technologically advanced, but then we act dumber than we used to before we even had this kind of technology about how to give access to people who don't have access. And I just think I so appreciate what you just said, Dr. Paxton, and I just think we've got to really push for, let's be innovative, let's push this envelope and go back to some of that stuff that we know works. Because, I would never have gotten library books if they hadn't brought the bookmobile down our dirt road to my house.
Yeah.
I hope it is taught us all to just go back to the basics.
Yeah.
That's all it takes, is for us to just go back to the basics. And we're innovative in that way alone, because we're re-energizing something that may have happened 30, 40 years ago, but let's just bring it back. We try to get so fancy and technologically savvy to things when sometimes we can just go back to the basics.
That's right. That's right.
So can we, I would actually love to expand on that, Ms. Foster, of like, let's go back to the basics, because I do think some of that basics is just, this community conversation that we're having, right? Talking to our neighbors, opening up, sharing our successes, but also our struggles. Like, it's nice to kind of feel not so alone. And, Zoom is great. Virtual meetings are great, but I think we're all missing in person, right? I think some of this has brought us to feel even more isolated. So what are some of those basics that maybe we as a community or a neighborhood or just neighbors, right? Like, that can wave at each other across the street. Like, what are some of those basics that we can all get back to, while we're trying to also be like super fancy with the telehealth and the innovation and the technology and the IT? What are some of those basics?
So I think you hit on it already. Being a community, waving at your neighbors. I think pre-COVID, everyone was so consumed with their day-to-day life. I mean, we pack our schedules as though tomorrow may not happen. I mean, we're getting kids to baseball games, cheerleading practice. You're sitting in traffic 2 hours to get to and from work. You're trying to get home. You're trying to cook. Do this, and this. I mean, literally, if you think about your schedule or your friend's schedule or your mom's schedule pre-COVID, it's packed. And you look at it now like, how did I do this? So just going back to the basics where you are waving at your neighbor, you actually know who your neighbor is. How many people live in communities, they don't even know who their neighbor is? And so I just remember growing up where I lived it wasn't a neighborhood, it wasn't a subdivision, but we lived in a community where people knew one another, where I knew your neighbor knew your children. And I mean, I just think the world has become so disconnected. And I think COVID hopefully has taught us how to reconnect with individuals, with our family, with our community, because it's gonna take a community for healing. I mean, we can't individually heal without a community embracement. So I just feel like this is a time for the community to, as I said earlier, educate yourself on mental health resources, know what's available, so that if you run into a neighbor and they're talking to you about their child, you can say, oh, wow, I just listened to this webinar, or I just participated in this meeting, and there's a clinic right up the road. And you can call, you don't have to pay. I mean, just having that knowledge where when someone comes to you, and they may not even be reaching out, but all of a sudden you just become a connection point for them, right? You've given them a resource that perhaps they would have missed because you sat somewhere for a moment just to obtain that education so that you can empower your community and empower yourself.
That is powerful. That is very powerful, and I couldn't agree more. And it just gets me thinking, and this goes back, Dr. Paxton, to what you were saying earlier. You know, at the Fulton County Health Department, you're drinking from a fire hose, right? When you came on in May, and you were just trying to put out one burning inferno after another. And now that, you know, hopefully, you know, like everything seems to be going a little smoother and the vaccines are starting to roll out. What, from a community public health standpoint, what are some of these things that you all are now able to take a breath and look further down the road on that, you know, we should probably start thinking about now, and we should probably start planning now, whether it's getting back to the basics or being innovative? What do you and your team see anything in general, but then also around mental health that, you know, we as the community should start preparing for and helping one another through?
Well, I think more in general, I'm not going to speak about, because I'll be honest, we haven't been speaking mostly about you know, mental health services at the Board of Health. We've been talking about, as I said, getting back to very like HIV testing, the TB, so many things. The opioid crisis has really been taking a back seat to
which all play in, right, to the mental health. Yeah,
and they all do. They absolutely all do. So the things but what we have realized, and in fact, we actually just recently had, we actually hired a consultant group, an outside group, to come in and look at sort of the way that we are operating. And it was actually well worth all the money that was spent on this, because it generated a whole bunch of ideas. And I think I can characterize them in terms of some of it is the going back to basics, you know, getting back out into the community to do these services. But we also realized that we could do a better job of integrating the more innovative things. Like, for example, doing a bit more telehealth for people who can do telehealth. We realized that even something maybe simpler of having a more centralized scheduling system, so that people could just call like one number and then could figure out what, you know, where they need to go for all of our many, you know, services. You know, we intend to get out there and ask more in the community about what do you want, what do you need, and what do you want to see us doing. But then again, and as I said, we are going back out. We realized that COVID showed us, as if we already knew this, but it really showed us, is that you have to go where the people are. That sitting back and waiting for somebody to come to you is not going to be the best thing, because there are many people who need to be seen for various things, but for whatever reasons, that whether it's economics, whether it's distrust of public, you know, of medicine or whatever, for many, or just access, that they can't come and come to you. So you have to go to them. So we are in the midst of implementing that, you know, to taking a good hard look at how can we do more, how can we get out further into the community to deliver services, needed services to the community. And again, so I'm saying, and I think that, you know, I see no reason why that sort of model could not also be done for behavioral health services, not just the sort of physical health services that we, for the most part, provide.
Thank you for that. I didn't know, Ms. Foster, is there anything that, you know, to add as with all of the programs that you already were doing before COVID, and then it sounds like you just kind of ramped them up, right? Because the need was there. Do you see, you know, now that hopefully we're starting to come out on the other side of this, what are some of those things that you think we should be paying attention to and kind of coming together as a community to help one another?
Well, I think we're getting ready to see a surge in the demand for mental health and substance use disorder treatment. I don't even think that we've touched the surface for the number of individuals that are in need of access to care. If I just turn on the news, every day there's something around crime, shootings somewhere happening every day. The number of sales around alcohol increasing, the number of sales around guns increasing. So I think all of that is going to have an impact on individuals in need of treatment for substance use disorders, as Dr. Paxton indicated earlier about the opioid epidemic, the opioid crisis. It's not gone. I mean, it hasn't been talked about as much as it was pre-COVID. We're still doing work around it, but I just think that we're going to see a surge in suicidal ideations, ensuring that we equip the community to teach them around recognizing signs that someone is depressed or that someone is sitting back, perhaps feeling hopeless. And how do you position yourself so that you're able to get that person connected to care? I think it is so imperative to me that whomever you are, you equip yourself, whether it's for you or someone else, to be prepared that you may be that first person that someone encounters that's in need of help. And so I always just encourage people, please just know the resources that are within your community, only if you identify one or two, but know something, because you never know who you're going to interact with that's in need of some type of resource, or perhaps you could have saved their life. Because ongoing stress does what? I mean, and this turns into our physical well-being, is that if I'm constantly in a fight or flight mode, that increases my blood pressure, right? So I'm tensing up all the time. So now I'm going down the path of hypertension, but I'm not going to get into Dr. Paxton's area, so I'm going to leave that one alone. But I mean, it creates an impact on our physical well-being as well when we're constantly feeling like we're anxious or experiencing some type of trauma, or if we have these constant fears or worries. I mean, I looked at my children when we had these ongoing protests, and I just had to make sure that I sat down with them and connected with them and had the conversation, because what I didn't want them to do was start suppressing these emotions and feeling like they couldn't talk about it, or they couldn't find a safe place to talk about it, or because of how they're thinking, they go out and engage in some negative behavior because now they're vomiting out all these feelings that they never had an opportunity to process. So we just made sure that we had the realistic conversation about racism, what they can do to protect themselves, and just making sure that when they feel like they're in a situation that is contributing to them saying, you know what, I think this may be a little racism going on here, that they have a safe place to come and talk about it and process what just happened. But I didn't want them to continue to stuff their feelings and then find themselves, they're out protesting with someone, and then all of that stuff is regurgitated and it just turns into something negative.
No, that was know the mental health resources in your community. It could save a life. Like that's incredibly powerful. I'm naive. Like, how would I find that out? Like, does the Fulton County Board of Health have that? Like, how do I find those resources, whether it's for myself, for my family members, or for my neighbor across the street who might need that? How do I equip myself?
Right. And so what I always start with, because every state is different, but every state has community behavioral health centers. And so first, recognizing that the Department of Behavioral Health and the Department of Board of Health are two different agencies. Do we do work together? Yes, we do, but two different agencies. And knowing what one agency offers versus what the other agency offers. So if you want to equip yourself to be able to link someone to behavioral health services, when we say behavioral health, what we mean is mental health and substance use disorders. So when you hear someone say mental health, they're just talking about mental health. But if they're incorporating substance use disorders, they'll use the word behavioral health. So just maybe Googling community behavioral health centers near me and see what comes up. And that will be your starting point.
Thank you. Thank you for that. And it just, I know we have a couple minutes left. I didn't know if there were any questions, Dominique or Dr. Meeks, that you all had or were in the chat.
We actually have 15 minutes, so we're not
Oh, okay.
we're
No,
not
that's
out
right.
of time yet.
Too pressed.
And I do have a couple of questions. One of them has to do with, there's still a lot of stigma around owning a mental health issue. You know, we expect people with mental health issues to fix themselves. We expect them to act right. I've been going through this with my niece, who's has a lot of mental health issues, but you would never expect somebody to walk if their leg was broken. But
Right.
somebody can have a mental health issue and you want them to get it together, you know. So do you have some suggestions about how perhaps we as a Center for Racial Healing could engage in a community with making mental health concerns more palatable, and making the point that we need to stop ostracizing people when they're depressed or having anxiety issues or whatever, because that's no different from if your leg is broken or if you've got appendicitis. And we would be happy to help you get help if your leg is broken. But if your soul is broken, we think you ought to go sit on a rock somewhere and get it together, you know?
That was powerful what you just said. And we always use those analogies. We're telling people, hey, if someone told you had diabetes, you'll be running to the doctor. Well, some people would run to the doctor. Some people would still ignore it.
Right.
But with mental health, I think that we have been trained to think as a community that you can snap out of it, right? It shows resiliency in a woman to be able to take all these things on your shoulders and keep going, you know, just keep going, jump up and dust it off. Well, sometimes you can't jump up and dust it off. And sometimes you just need that safe place to be able to have someone that's objective, where you can express your life experiences, and then you're able to process those life experiences. And what you'll find is that people will come to therapy and they will talk about things that happened to them when they were 6 years old. But guess what? Now they're 50, but they've been dusting it off so long, but now they're to a point they can't dust it off anymore. I need to deal with it because what it's doing is it's impacting my ability to function on a day-to-day basis. I can't hold down a job. I can't raise my children. I find myself sitting in the corner drinking alcohol or trying to utilize some illicit substance, right? And so I think that people think of obtaining mental health services like, oh, you're crazy, you're going to have to be put on medication. Well, medication is not always the answer for everyone. So everyone has their own course of treatment. Everyone's course of treatment will not be the same, but I think it's imperative for people, when you feel like you're overwhelmed, or if you know that mental health runs through your family, seek help. Because perhaps your dad was a schizophrenic. And so therefore you may be predisposed to become a schizophrenic, right? But there's nothing wrong with that. There's people that live every day that's diagnosed with schizophrenia, but they take their medication and they stay engaged in treatment. And that's why we always tell people that recovery is possible, because regardless of what the mental health diagnosis is, or if you have a substance use disorder, treatment is available and recovery is possible. And you'll be amazed at the number of individuals that you see that live with a mental health disorder every day. And they are functional, they are independent, and they do very well for themselves within the community and give back.
Yes. And then I have one other question. I don't want to be the hog the questions here, but these things I have had experiences with. Sometimes when people reach out to get services, the process is complicated, and you're already not well, and then and all of this is new to you, and then you come up against a system that kind of seems unfriendly toward you. So do you think in Fulton County, the system is friendly? If I'm the, person seeking out, I remember driving around in LA with my teenage sister crying in the car because she was having a breakdown, and I couldn't find anybody that would give us any help. And it was like, by the end of the day, both of us were crazy. I mean, we literally were, because I was a kid myself in college. So if I'm out here in desperation, how easy is it for me to access the resource?
The goal is to make our services barrier-free access services to care. Does that mean you will pick up the phone today and make the call, and you'll get someone on the phone and they'll tell you, come on in today or we'll come to you? No, I will be honest. The system in itself is complicated, even for behavioral health professionals. If we have someone that's in front of us and they're perhaps in need of housing, the hurdles that we jump through trying to get someone housing, they may sit in front of me for 12 hours as I try to navigate this complicated system to get them in the necessary resource that they need. It's an ongoing struggle for agencies that provide mental health and substance use disorder treatment to make the system simple, going back to the basics, right? Where I can just pick up the phone and make an appointment and that's it. But it seems like you're constantly jumping hurdles. I will say that we have a website where we're trying to make it, you can make an appointment online. For those that can't, there's a phone number that you can call and make an appointment. We try to get people in within 3 days from the point that they call us, but we also have same day access. So if you call me tomorrow morning and say, I'm in need of treatment, I can tell you, come in today as long as you get here before 3 o'clock. So that's a plus. It's a plus that we get people in within 3 days from the point that they first make the phone call. Is it enough? No.
Thank you.
You're welcome. And you had to ask one of those challenging questions. Well,
I've lived in that world so long, working with people with no resources, trying to get help. And I, as a professional, was worn down by the end of the day. And I would think, what if they didn't have me to help them? They would just throw up their hands and because that's what I felt like doing, but I wasn't going to do it because of my commitment to getting help for them. But I appreciate what you all are trying to do. And I do think that making things more accessible is really a part of the challenge going forward, to have a system that's really more friendly and giving the services it intends to give.
I think it's agencies working together to have a seamless process. So creating a provider network within your respective counties is a big push of mine, especially in Fulton County, is that we fund a lot of agencies to provide a lot of services. And so therefore, in my eyes, if you're receiving funding from county government to be a team player within our provider network, then if we need your service, we should be able to access your service. So just trying to create a provider network and holding agencies accountable to ensure that they are a part of this network, they are a part of this referral process, that you implement key performance indicators to ensure that people are meeting the standards that you've set before them to make sure people have access to care and have access now. Because if someone picks up the phone and they say, hey, I'm in need of mental health services, do you know what it took for them to pick up the phone and say, I need mental health services? And for them to do it and then be told you have to wait 14 days is never acceptable.
Right.
This is much needed. Thank you. I see here a few questions. The first one is, how does the homeless population receive mental health help?
So during COVID, the county was really innovative. There were several hotels within Fulton County that were empty. And so through a collaboration with the state as well as the city of Atlanta, we converted those 2 hotels into a safe place for the homeless. And we wrapped them with behavioral health services for those individuals that had substance use disorders, but they were homeless, for those individuals that had mental health disorders and they were homeless. So they were placed in these, what we called healthy hotels, And then they were provided with services while they were in the healthy hotels. And then, of course, we had a separate hotel for those individuals that actually tested positive for COVID, but to ensure that they were isolated from others and not infecting other people if they continued to be on the street and interacting with others as, you know, they went through the journey of homelessness. And then I will say from that project alone, we were able to transition individuals from the healthy hotel. So once, you know, they were cleared from COVID symptoms, they were transitioned to the healthy hotel. They were provided with services, mental health services, a meeting with the psychiatrist. If they needed medication, needed to be placed on medication, a case manager would work with them. And then what we started doing was identifying those resources that they needed to transition them out of homelessness. And we have been successful with transitioning these individuals into permanent supportive housing units, as well as obtaining Georgia housing vouchers to get them in their own place. So they're no longer homeless. So I will say out of COVID, I'm very proud of that initiative, which still lingers on because we still have a few people that are still in the healthy hotels.
Wow, thank you. The next question is, well, this is interesting. It says, do you believe that loneliness is a mental illness? What are the remedies when you don't feel like you fit in anymore or have lost your community to COVID? You all touched on, and I believe Dr. Paxton touched on this, but you all touched on community, but how does a person who has lost their social group totally flipped upside down salvage the community?
Loneliness is not a mental health disorder. However, what manifests out of the loneliness may place you in a position where you're having a mental health struggle. So I think loneliness is going to trigger various things within your mind. And then where will your thinking lead you to? Will you begin to defeat your own self-worth because you feel like you're disconnected and disengaged from individuals and you're just in a dark place? So my recommendation is that you implement what therapists and mental health professionals say, effective coping skills to make that transition, right? If you know that you're lonely because you feel like you're disconnected from people, start taking some small steps to reconnect with individuals. One thing that I found interesting is that when we launched our program around senior citizens doing a pen pal program, how many of them I spoke to that felt lonely, even though they were in the home with perhaps their significant other, but they just felt lonely and disengaged from or disconnected from people. And so just figuring out a way to reconnect on a small scale, because sometimes it's hard to just jump right in head first, but starting maybe with one person. We started writing letters. Some of the seniors wanted us to write letters, old fashioned, going back to the basics, just writing a handwritten letter to them. Because why? They didn't want emails. They didn't do emails. They didn't do text messages. But if you're feeling a sense of loneliness and disconnection, my recommendation to you is to figure out how to connect with someone on a small scale. Maybe start with one person. Journal writing is always good so that you can go back and reflect where you were a week ago so that you can see that there's progress. So if you're in a place right now where you feel disconnected, you feel lonely, I would say start journaling. Journal today, how you feel today. Tomorrow, establish a small goal for yourself. And perhaps that's just to reach out to one person. Maybe that one person that can always generate some laughter in you, or that one person that you've had some great memories with that you can just call them and just reflect on the great times that you've had together. And then perhaps set another goal for yourself for the next day or 2 days later. But start setting some small steps, objectives, so that you can reach the overall goal where you feel reintegrated with your community.
That is pretty incredible advice. Thank you, Ms. Foster. I know that we only have a few minutes, Dr. Gander and Dr. Meeks, but we have two more questions here. One of them is, let me see, where did it go? Can an adult or a person past 18 who refuses to take mental health medications because they are mentally ill, can that be superseded by a caretaker who know that this person needs mental health services or mental health medications?
No. The only way it can be, so if you're referring to if they can be 1013 and forced to take medication, is if they present to be a threat to themselves or to someone else. So if they're suicidal or homicidal, that is the only way that they can be 1013 and remain in the hospital, because what people find is that they will call the police or call the emergency room to have someone hospitalized because they're not stable, and that they become frustrated with the system because they're released within 3 days, not 3 days, 3 hours. But what people need to recognize is there are laws, and even though someone has a mental health disorder, they still have rights. And so we cannot take away their rights just because we feel like they're mentally unstable. If they are not a threat to themselves, which is suicidal ideations and or homicidal, then they will not be able to be 1013. And no, you cannot force an adult person to take medication.
Thank you. And the last question is, I actually have this one. Are there any known initiatives in mental health education, for mental health education, like in the school system?
Yeah, so we have school programs actually where we have on-site therapists within the schools. They're actually integrated into the school so that students don't have to leave school to obtain that necessary service. We also, with those therapists that are assigned to the schools, we provide them, we provide the parents with community conversations in the evening so that they're educated. And we also train the school officials on trauma-informed care so that they're aware of how to recognize an individual that may have some mental health symptoms, and or typically we don't really focus too much on substance use disorders in the school setting. It's mainly around mental health, but we do have programs set up for individuals that are struggling with substance use disorders as well.
Thank you so much. What is the name? Is there a name for the program for the after-school thing that you mentioned for the parents?
So the parents, it is contingent upon the respective school that the therapist is assigned to. So what happens is the therapist will offer evening programs for the parents, and they're required to do those at least 4 times per quarter. And it's just called the Fulton County School-Based Mental Health Program. And then there's also a program called APEX, APEX project, and that's through the state of Georgia.
Thank you so much. Dr. Gander, Dr. Meeks?
I think my last question for both our panelists is, you know, we've talked about innovation, we've talked about getting back to the basics, we've talked how quickly people have been able to change and pivot during this challenging time. And I think, Ms. Foster, you had mentioned this actually in a 2020 panel discussion that you facilitated about, you know, now that the spotlight is on mental health, or now that we're seeing just how our physical health, right, the COVID or the illnesses or the isolation can actually impact our mental health, and then vice versa, right? Our mental health can impact our physical health. Like, how do we not lose this traction? And we've spoken about some of the granular, like in the weeds, community efforts, but maybe from a larger perspective, you know, whether it's talking to our policymakers or thinking about education programs that you talked about, not just to teach our children and our educators what to look for, but maybe the public health professionals, right, who have been struggling, or any professional out there that are struggling to learn that. So how do we not lose this traction of having this a brighter spotlight on mental health?
So Dr. Paxton, I'm not sure if you want to answer it from a public health perspective first, and then I can finish off with the mental health.
Certainly, I can give it a try. As I said, as I've sort of been saying throughout, is that we are in a position of striking while the iron is hot, striking while we have people's attention on the problems, and while we have sources of funding coming in. So we are taking advantage of that at the Board of Health to the extent, every extent that we can. Every single grant that we are eligible for, we have applied for. And
Yay.
so far we've gotten them all, and we have plans for how to use them. So, I mean, that is our philosophy, and that's, you know, what I would say we need to do.
And I would definitely agree with Dr. Paxton is that now that the funding is out there, it is imperative for all agencies to ensure that they apply for this funding. I think it is imperative for agencies to begin to look within your own counties and work together so that we can come up with a seamless process, a no wrong door for each county, each state. But for me, it's imperative for the county agencies to work together and ensure that they have a seamless process for referrals. How do you connect one person if they come through this door, but they need to be in this door, so that you're not burnt out trying to get someone through the process of obtaining help? And it shouldn't be a process. We should just be able to pick up the phone and get someone connected. But I think now that the funding is there, it's imperative for agencies to apply for this funding. A lot of the funding opportunities that are coming out call for partnerships, and they want you to demonstrate how you will partner with other agencies. So that's imperative, that's important as well, because it's forcing agencies to work together to address the exact same problem that we're all trying to tackle, especially in my world around mental health and substance use.
Well, yes, I do.
To work together.
Thank you all so much. And you know, it's very heartening to hear the two of you talk about this and to know that there are people like you in this world doing this work. And I hope you, Dr. Paxton, won't retire again too soon so that some of these things can get done, because there has to be somebody with some common sense and some passion to get the work done. You know, you know that it's not rocket science. It's just a matter of being clear-headed and willing to stick with those kinds of things that aren't quite as fancy as some of the other stuff we try to do that doesn't work. And so I'm so grateful for your attitude and your approach to this work. And thank you so much. And thank you, Dr. Gander, for bringing the you know, I'm so delighted for working with an epidemiologist who I can actually talk to, because folks are so into statistics and all that stuff, and it loses me. So I'm so grateful for all of you. And thank you so much. And the Center for Racial Healing is available to partner with you anytime if you think there's something we can do that can help with getting the word out or strengthening what you're trying to do, because I believe we've got to be collaborative and share resources and information, because we're all trying to do the same work. So thank you, participants, for joining us. This recording will be sent out to people who registered and people who were in the first town hall meeting. So we will get a bit of widespread sharing of this information, because we want to encourage people in every jurisdiction to think more like these women tonight have been talking, and to be practical and really work at trying to really and truly fix things, rather than just spinning our wheels and feeling like we did something because we're so tired, but we didn't really do anything because we went at it in the wrong way. So thank you so much. And thank you, ladies, for being with us tonight. And we will call upon you some more. And please call upon us.
Thank you for having us.
Yes.
Good night,
Thank you all.
everybody.
Good
Good
night.
night, everyone.